Now let's talk about some pathology. If you're in year 7 or you just don't know what pathology means, anytime you hear the ending ology, that means a study of. Pathology is a study of causes and effects of diseases, or just diseases, conditions, and issues in general. The first condition I want to talk to you about has to do with a structure called the foramen ovale. Now the foramen ovale isn't present in this model, so I'll put a picture up. The foramen ovale is also found in the skull, the base of the skull, and this is where your mandibular nerve will come out of, along with other structures. However, the foramen ovale in the heart is located in this area over here. So we have a wall separating the left and right sides of the heart. We call that a septum. And the foramen ovale in the heart is found in the septum separating the right and the left atrium. Now, the foramen ovale is a fetal remnant, and it's a pretty cool thing when it's working properly. When you're a baby in your mother's womb, you don't really need to use your lungs because you get oxygen and nutrients from your mother via the umbilical cord. So this foramen ovale allows for blood to go straight through from the right atrium to the left atrium. So this essentially allows the blood to bypass the pathway of going to the lungs, because we don't need to use the lungs when we're in our mother's womb, and the blood just gets pumped around the body. It's pretty cool. Now when you're born, the foramen ovale usually closes up to allow for normal respiration. Sometimes it doesn't close, and we call this issue the patent foramen ovale, or PFO for short. And this leaves an opening in the septum, allowing for some blood to flow between the atria, escaping the respiration process. Now, most people who suffer from PFO don't really experience symptoms of this hole, but there is a lot of research suggesting that the condition contributes to migraine headaches, and it also increases the risk of stroke and heart attack. Now, there are two more conditions that I'll discuss, and I'll discuss it together because they're often confused and used incorrectly or used interchangeably. So these two conditions are a heart attack and a cardiac arrest. Now, to put it simply, a heart attack is when the blood flow going to the heart is blocked, whereas a cardiac arrest is when the heart malfunctions and suddenly stops beating unexpectedly. A heart attack is a circulation problem, whereas a cardiac arrest is an electrical problem. So, in a heart attack, this occurs when one of the arteries supplying the cardiac muscles with oxygenated blood becomes blocked. So here we have the main aorta, and off the aorta we have these red arteries, and we call them coronary arteries. They supply your heart muscles with oxygenated blood, with nutrient-rich blood to keep the heart going. And sometimes these coronary arteries become blocked, and this is when you get a heart attack. And the medical term for a heart attack is myocardial infarction. The blockage is usually a result of a formation of a blood clot within a coronary artery. So when there's a block or a blood clot in a coronary artery, that stops the blood from going through to the rest of the heart after it's been blocked, and the heart muscles just don't receive the nutrients and oxygen that it needs. Now, another way that a coronary artery or artery supplying the heart can be blocked is atherosclerosis. Now, atherosclerosis is a condition where fatty deposits called plaques build up on the inside wall of the coronary artery, ultimately reducing the blood flow. And if a coronary artery is blocked for too long, the heart muscles don't get the oxygen or the blood or the nutrients that they need, and it begins to die or go through a process we call necrosis. And I'll leave a link in the description if you want to read more about heart attacks or myocardial infarctions. Now, the other condition that people tend to confuse with heart attacks is cardiac arrest. So cardiac arrest is triggered by an electrical malfunction in the heart, and this causes an irregular heartbeat, which we call arrhythmia, cardiac arrhythmia. Now, the brain sends electrical impulses to the rest of the body, and these signals, these impulses, tell the rest of the body what to do. Cardiac arrest is a result of these impulses, these electrical signals not working properly. And the electrical signal is disrupted, causing the arrhythmia. And sometimes it causes the heart to stop beating properly, and sometimes it even stops it from beating completely. And we call this, or it's arresting the heart, which is why it's called a cardiac arrest, which is a medical emergency. Hey guys, so that's a tutorial on the heart. Like I said, if you're in year 7 and year 9, there's a lot of this content is far beyond your scope and what you have to know, but it is quite interesting. I hope you enjoyed the video. Hope you learned something about the heart and just know how it works better in your body. Thanks for tuning in to Science with Mr. Duong. See you next time.